Dr. Tom here again, in the midst of our discussion about the various categories of dysfunction that we see presenting into the office. Now, we talked about the first way that a person accommodates to the stresses of their life as a Category 1 response. We talked then about how the sacrum and its relationship to the hip bones, or the ilia, can deteriorate, which we would call a Category 2 dysfunction. The last thing that occurs is what we were going to call a Category 3 dysfunction. And here again, our brain and our nervous system, and we discussed the relationship of the sacrum and the ilia, and as it begins to deteriorate, the relationship of the spinal bones and the disc material between them encounters an enormous amount of stress. And as a result, this disc material can begin to bulge, and if left to go far enough, can actually rupture. Now, this is a very acute, extremely painful experience, and oftentimes, because of the severity of the pain, people will actually go to the hospital or the emergency room as their first intervention. Oftentimes, an MRI will show actual bulging or sometimes a rupture, and at that point, most people are guided towards a surgical intervention. But I want you to know that we worked extensively with people with disc kinds of dysfunction, and as long as they are willing to commit to the care required, we are able to get a complete remission of these symptoms. So what occurs is the disc material begins to put pressure on the nerves that go into the leg. So not only will a person experience pain in the back, they'll often experience what is a true sciatica, that is, an irritation of the nerve which causes pain going right down the leg. Our goal here is to use distractive techniques, that is, pulling apart the spinal bones as a way of putting a reverse pressure into the disc. Now, there's lots of extremely sophisticated equipment that is specific for accomplishing this goal, but there are other ways to do it that are actually quite efficient and much less expensive to do, which you're able to do in the office. When we reduce the pressure on the disc, the body's able to heal itself, and we can move a person through the entire course of categories as close to 100% function as possible. So again, this disc presentation is what we would call a Category 3 presentation. And while it can be extremely frustrating for people, causing a great deal of pain, it's important to know that there are non-surgical and non-pharmaceutical ways to manage this particular presentation. Thanks.